Hi, my name's Gene Cash, and I'm a faculty member at the Center for Psychological Studies at Nova Southeastern University. I'm also a Florida licensed psychologist and the past president of the National Association of School Psychologists. Today, we're going to be talking about coping with trauma and grief and the critical role of resilience in that coping process. So let's move to our first slide and talk about what is resilience? What's the definition, and what are the components of resilience, and what are some of the key characteristics that are really important for our presentation today? First, it's important to know that resilience is a positive way of adapting. Adaptation to, or the ability to recover from, adversity, trauma, any difficulty in life circumstances, threats, terrorism, any trauma that causes a person grief and distress. Resilience is the ability to bounce back from that trauma and from those stressors. It's also a healthy response, a positive response to such stressors. So resilience is healthy, positive responding to any kind of life stress. A key component of resilience, or a key thing to remember about resilience, is that it's not innate. That doesn't mean that there are no predispositions to be resilient or more or less so, but resilience is a characteristic which can be taught and can be learned. As a result of that, we have tremendous opportunities for intervention early in children's lives, and for intervention therapeutically if necessary. There's a culturally competent definition of resilience as well that was brought forth by Unger in 2004. And that definition is that resilience is the outcome from negotiations between individuals and their environments for the resources necessary to define themselves as healthy amidst conditions collectively viewed as adverse. In other words, a person who can view themselves as healthy and functioning and effective despite traumas, stresses, and environments that are unhealthy or extremely stressful is a resilient person, regardless of the nature of their culture and the nature of their upbringing. It's also important to consider that resilience may be thought of in a different way. In physics, for example, resilience is sometimes referred to as disambiguation, that is, removing or reducing the ambiguity in a situation that has physical consequences. If we think of trauma and grief as factors that produce the need for resilience in human beings, then those, the trauma and the grief, the stressors of life, might be called ambiguation. As a result, events or emotions which heighten ambiguity are ambiguating. Resilience then would be reduction of that ambiguity. Any of the factors which reduce ambiguity in a situation or produce disambiguation in a difficult or complex situation that stresses an individual or that traumatizes an individual. What are some of the characteristics of resilience? What is it that what things go into making up a resilient individual? Because if we know what those characteristics are, then we can train them, we can teach them, we can foster or facilitate them in individuals. One is the capacity for planning and carrying out planned actions. Some of you who have a neuropsychological background might recognize that as an important executive function, a frontal lobe function of the brain. So if one can plan effectively and can follow through with those plans, not only is that resilient, but it's also an effective way of responding to the environment. A positive self-concept is important in resilience. Confidence in one's personal capabilities, in one's strengths, in one's ability to cope. So that aspect of self-confidence, as we know from the psychological literature, can be trained, can be taught, can be encouraged in individuals. And the more self-confident an individual is, without being narcissistic, the more likely it is that they'll be resilient. Communication skills and problem-solving skills are also really important features or factors in resilience. If a person can communicate effectively what they need, what they want, what they intend to do, and if they know how to solve problems, then they're going to be able to bounce back better in the face of life stressors. And problem-solving skills can be taught. Communication skills can be taught. But imagine how it would feel to you if you found yourself in a country in which you didn't speak the language and had no effective means of communication. That would make you very rigid and non-resilient in that kind of situation. And if you had limited problem-solving skills, you can see that that would not contribute to your effective functioning in a situation like that. That's the antithesis of resilience. Management of feelings and impulses is critical for resilience. Those people who don't have a good handle on their feelings, who find themselves overreacting or dysregulating when they're under stress, are not resilient people. On the other hand, those who manage feelings, channel them effectively to help motivate them rather than guide or direct their behavior, are going to be more resilient than others. And as we know, psychotherapy or counseling can be ways of helping people to understand their feelings more effectively and to channel those feelings more effectively. Having realistic optimism is critical for resilience as well. The optimistic person is one who believes that they can cope and who thinks that things will work out in the end, that they will eventually be okay. Optimism causes people to continue trying in the face of adversity, and that's part of the definition of resilience. Pessimism, on the other hand, causes people to give up too quickly and too easily. Seligman's work on learned optimism suggests to us that we have the potential for intervening in that way and for teaching people this important component of resilience. Resilience also involves an internal locus of control. People who are confident that what they do matters, what they do makes a difference in the real world, are going to be more resilient and better able to cope with stressors. Those people who have an external locus of control, feeling constantly that the world happens to them, that what they do doesn't make very much difference, it's all up to fate or the gods or whatever, are going to be far less resilient. And clearly the data indicate and the research indicates that we can intervene and teach a more internal locus of control. Other characteristics of resilience are just a personal belief in oneself. Risks resulting from unresolved trauma and grief. And what is it that happens when we don't effectively resolve the aftermath of trauma and grief? Well, there are several things that can come about as a result of that, several negative consequences. One of those is academic or job failure. Kids who are victims of trauma and grief and who are not resilient, who develop things like post-traumatic stress disorder or adjustment disorders, have a tendency to do poorly in school. Adults who come back from a war venue, for example, and who are limited in their ability to cope, who have post-traumatic stress disorder or who have some other kind of anxiety-related disorder or depression that has resulted from trauma, have difficult times finding jobs and difficult times keeping them when they find them. Social maladjustment is also a potential consequence of unresolved trauma and grief. Social maladjustment is not only having difficulty interpersonally, social maladjustment is also related to those things that we tend to call conduct disorders, that we tend to call oppositional defiant disorders, that are the disruptive behavior disorders and that often lead to personality disorders such as antisocial personality. So unresolved trauma and grief, especially early in childhood, can have personality consequences later on in adult life. Health problems often result from unresolved trauma and grief. People tend to somatize depression in many cases. People tend to break down in their resistance to disease when they have anxiety disorders or when they have not effectively resolved a grief or have not effectively dealt with a trauma. Poverty can result from unresolved trauma and grief. In fact, many people who live in poverty have experienced early on in their lives abuse, maltreatment, some sort of trauma or loss over which they've had little control and over which they have not been able to adjust, or after which they've not been able to adjust. Mental illness of various kinds can result from unresolved trauma and grief. As you well know, adjustment disorders are overreactions to traumatic experiences or stressors of life, but many anxiety disorders, many mood disorders, and other kinds of disorders, we mentioned personality disorders earlier, can be mental illnesses or mental disorders that are a consequence of not having effectively dealt with losses and traumatic events. Substance abuse is a common way in which individuals attempt to cope, but with maladaptive and negative consequences to trauma and grief that have not been resolved in their lives. When people experience guilt, overwhelming guilt, it's often because they have not effectively dealt with the losses and traumas in their lives. And unresolved grief and trauma can lead to involvement with the juvenile justice system, involvement with the legal system as adults, can lead to criminal behavior, can lead to behavior that, even if the intent was not criminal, may land a person in jail or in a juvenile detention facility. Those are all potential consequences of not having enough resilience, not being able to bounce back from life stressors. To the pessimist, lacking resilience, all of life is a crisis. And that's a tremendous problem. We talked about the negative effects of pessimism earlier, and one of the characteristics of resilience is optimistic behavior or an optimistic approach to life that can be trained. Those who are pessimists have difficulty with that, but that can be improved. To the resilient optimist, on the other hand, there's an opportunity in every crisis. And that's so important to remember about resilience, that looking for the opportunity in a crisis can make all the difference when trying to resolve grief experiences and traumatic events in one's life.